Have you ever thought about how crucial understanding thyroid and antithyroid drugs can be, not just for patients, but for medical students and professionals as well? This is a question that may not cross your mind often, but the answer is significantly important. Thyroid and antithyroid drugs play a pivotal role in managing conditions such as hyperthyroidism and hypothyroidism, which affect millions of people worldwide. They help regulate the thyroid hormones in our body, ensuring our metabolism, heart rate, and body temperature function smoothly. For healthcare providers and medical students, understanding these drugs and their effects isn't merely academic. It's a matter of life and health. It's about being equipped to provide the best care possible to patients dealing with thyroid disorders. So as we embark on this journey of discovery together, let's dive deep into the fascinating world of thyroid and antithyroid drugs. As we delve into the fascinating world of thyroid and antithyroid drugs, prepare to unravel the intricate details of their biosynthesis, mechanism of action, and pharmacology. To truly appreciate the power of these drugs, we must first understand their genesis. The biosynthesis of thyroid and antithyroid drugs is a fascinating process involving an intricate interplay of chemical reactions. The journey begins with iodine, a trace element that our bodies cannot produce on their own. This element is essential in the formation of thyroid hormones. The thyroid gland absorbs iodine from the blood, and it then combines this iodine with the amino acid tyrosine to create the thyroid hormones triiodothyronine, commonly known as T3, and thyroxine, known as T4. Now, why is this important? Well, these hormones play a significant role in our bodies, regulating our metabolism, heart rate, and even our mood. Therefore, when the thyroid gland is under or overactive, thyroid drugs come into play to restore the balance. Most thyroid drugs, like levothyroxine, are synthetic forms of T4. These drugs are created in labs, designed to act just like the hormones our body would naturally produce. When swallowed, they are absorbed into the bloodstream and taken up by the cells, just like the naturally occurring hormones. On the other hand, antithyroid drugs like methimazole and propylthiouracil work a bit differently. They are sulfur-containing drugs that inhibit the synthesis of thyroid hormones, thereby reducing the excessive production of these hormones in conditions like hyperthyroidism. These drugs inhibit the enzyme thyroid peroxidase, which is responsible for incorporating iodine into tyrosine residues on thyroglobulin, thereby blocking the production of T3 and T4. It's a delicate balancing act, isn't it? Our bodies need just the right amount of thyroid hormones to function optimally, and when that balance is disrupted, these drugs step in to either supplement the deficiency or curb the excess. With this knowledge, we can begin to comprehend the complexity of these drugs and their impact on the human body. Understanding the biosynthesis of these drugs provides us with a deeper insight into their function and importance, illuminating the intricate workings of our own bodies in the process. Now that we have a rudimentary understanding of their biosynthesis, let's delve into how these drugs actually work. To appreciate the mechanism of action of thyroid and antithyroid drugs, it's essential to understand that these drugs either supplement or inhibit the actions of the thyroid hormones, namely thyroxine and triiodothyronine. These hormones are pivotal in regulating our body's metabolism, growth, and development. Thyroid drugs, such as levothyroxine, are essentially synthetic forms of thyroxine. These medications increase the levels of thyroid hormones in the body, thereby boosting metabolism. They're typically prescribed for conditions like hypothyroidism, where the thyroid gland is underactive and cannot produce enough hormones on its own. When taken, these drugs fill in the gap and restore the hormone levels to their normal range, helping to regulate energy expenditure, body temperature, and maintain heart and digestive function. On the flip side, antithyroid drugs like methimazole and propylthiouracil function by inhibiting the synthesis of thyroid hormones. They work within the thyroid gland itself, blocking the iodination of tyrosine residues, a crucial step in the production of thyroid hormones. These medications are often prescribed for hyperthyroidism, an overactive thyroid condition where too much hormone is produced. By curbing this overproduction, antithyroid drugs help to reduce symptoms such as rapid heart rate, excessive sweating, and weight loss. But it's not just about the increase or decrease in hormone levels, it's about achieving Balance. The human body is a master of homeostasis, constantly striving to maintain a stable internal environment despite external changes. Thyroid and antithyroid drugs play a crucial role in this, helping to keep our thyroid hormone levels within a healthy range. So the mechanism of action of these drugs is not merely about ramping up or dialing down hormone production, it's about aiding our bodies in achieving that sweet spot of equilibrium, where all systems can function optimally. Understanding the mechanism of action of these drugs allows us to appreciate their role in maintaining hormonal balance. With a grasp on their mechanism of action, we can now explore their pharmacology. The pharmacology of thyroid and antithyroid drugs is a fascinating journey that begins with their absorption and ends with their excretion from the body. So, let's begin with absorption. Thyroid drugs, such as levothyroxine, are typically taken orally and are absorbed in the small intestine. However, some factors can influence this absorption, such as the presence of certain foods or medications. It's crucial to note that levothyroxine absorption can be hampered by calcium, iron supplements, and some types of food, like soybean flour. This is why it's often recommended to take these drugs on an empty stomach to maximize absorption. On the other hand, antithyroid drugs like methimazole are also orally administered and well absorbed from the gastrointestinal tract. The peak plasma concentrations are reached within 1 to 2 hours after administration. Now let's talk about distribution. Once absorbed, these drugs are distributed throughout the body. Levothyroxine, for instance, is highly protein-bound and is distributed into the body tissues, with the highest concentrations found in the liver and kidney. Methimazole, an antithyroid drug, is not protein-bound and can cross the placenta and be found in breast milk. Metabolism is the next step. Levothyroxine, the thyroid drug, is primarily metabolized in the liver, kidneys, and peripheral tissues. It's here that the drug is converted into its active form, triiodothyronine, which is then able to exert its effects on the body. Antithyroid drugs, such as methimazole, are metabolized in the liver. Their metabolism results in inactive metabolites, which means they no longer have any effect on the body. Finally, we reach excretion. The metabolites of both thyroid and antithyroid drugs are excreted in the urine. The half-life of levothyroxine is quite long, ranging from 6 to 7 days in individuals with normal thyroid function, while methimazole has a considerably shorter half-life of approximately 6 hours. Now, the pharmacodynamics of these drugs, or how they affect the body, is also noteworthy. Levothyroxine works by replacing or providing more thyroid hormone, which is normally produced by the thyroid gland. On the other hand, methimazole works by inhibiting the production of thyroid hormones, thereby reducing the symptoms of hyperthyroidism. In summary, the pharmacology of thyroid and antithyroid drugs encompasses their journey from absorption to excretion and the effects they have on the body. These drugs play a crucial role in managing both hypo and hyperthyroid conditions, making them invaluable in the field of endocrinology. The pharmacology of these drugs reveals the intricacies of their effect on our bodies and their potential for treating thyroid conditions. Having journeyed through the biosynthesis, mechanism of action, and pharmacology of thyroid and antithyroid drugs, it's time to consolidate our knowledge. Firstly, we delved into the intricate process of biosynthesis. We've learned that thyroid drugs such as levothyroxine and liothyronine are synthetic forms of thyroid hormones produced by the body. On the other hand, antithyroid drugs like methimazole and propylthiouracil work by inhibiting the production of these hormones, thus playing a crucial role in managing hyperthyroidism. Next, we navigated the complex mechanism of action. Thyroid drugs replace or supplement the hormones that the thyroid gland produces, helping to regulate metabolic processes in the body. Antithyroid drugs, however, operate by interfering with the iodine incorporation and coupling processes, ultimately reducing the production of thyroid hormones. Then we explored the fascinating world of pharmacology. We discussed how thyroid drugs are generally well absorbed in the gastrointestinal tract, and how their efficacy can be influenced by factors like age, body mass, and even the presence of food in the stomach. In contrast, antithyroid drugs are rapidly absorbed and widely distributed throughout the body, with their effects typically seen within 1 to 2 weeks after initiation of therapy. Let's not forget the importance of understanding these drugs. They are essential in treating a variety of thyroid conditions, from hypothyroidism to hyperthyroidism, and even thyroid cancer. By delving into their biosynthesis, mechanism of action, and pharmacology, we gain a deeper understanding of how these drugs work, which can help in making informed decisions about treatment options. In conclusion, the world of thyroid and antithyroid drugs is a complex one, filled with intricate processes and fascinating mechanisms. Each drug plays a pivotal role in managing thyroid conditions, and understanding their workings can greatly enhance our approach to treatment. With this newfound knowledge, we can better understand the role of these drugs in the treatment of thyroid conditions. Subscribe for more, because you won't find me later.